What are the common triggers of eczema and where does it usually occur?
So it's commonly in the creases, so that would be like the crook of their elbow when they bend their wrists or the backs of their knees. But in small babies, actually, it can present on the face first. So if you check their cheeks, they might have some redness and scaling on their cheeks, where you won't see that as commonly in adults. So the common triggers would be using harsh soaps or detergents on the skin. Obviously sensitised patients might be sensitised to the house dust mite or pollens. Baby skin, particularly the newborn skin, is a lot thinner, which just means that allergens can get into the skin more easily. Hence the reason it is really important to moisturise them so that you're trying to create a barrier to prevent allergens from getting in so that they're less likely to become allergic to things over time.
As a sufferer of eczema, is it likely that my baby will have it?
So if a family member has eczema, you have about a 1 in 2 chance that one of the children might have it, but it doesn't mean it'll be the same severity. The most important thing is the minute a baby is born, it starts to lose water from the skin. So you can imagine if someone's in a delivery room and then the baby's born into the bright lights and the warm atmosphere, you start to lose water. So it's really important to start the moisturising regime and the proper bathing regime from the minute they're born and not to wait and see, does the child develop eczema? The quicker you do it, the quicker they get used to it.
What is safe to put on a newborn skin?
So it's really important that you don't put anything that's heavily perfumed or fragrance onto a newborn skin. So you need to stick to plain products only. And that would be an example, La Roche-Posay Lipicar Balm. It's a really good product because it's very easy to use. It comes in a pump dispenser, which means that you're not reinfecting a tub, because obviously if a child has eczema, they've more bacteria on their skin. And if you put your hand into the tub, rub part of the body with the cream and then put your hand back into the tub, you're reinfecting it with bacteria. Whereas with pump dispensers, that's not possible. It dries in really, really quickly, which means it's cosmetically acceptable to children because they certainly don't want to have that sticky effect to their skin, so they're much more likely to comply with you putting it on.